Hi, this is Scott Proscia, certified athletic trainer and head performance coach at High Rep Athletics and a training plan source. Today we're going to be talking about ankle sprain. I think everybody has had that event. They're walking down the street and they invert their foot by stepping in a pothole and they sprain their ankle. A very common injury, and one of the things we are going to do is we're going to talk about injury management for this condition. All right, so when we talk about the ankle, I'm going to quickly go over some of the anatomy. You guys are going to have to bear with my drawing skills here. They are not the best, but we have a big, thick, weight-bearing bone called the tibia, and then we have a little thin bone on the outside called the fibula. All right, so this is the tibia, this is the fibula, and this sits on bunch of tarsal bones, and this one on the top is the talus. All right, and then we have the foot. All right, 5 toes. Okay, so we have the foot going down here. We have the metatarsals, and then the phalanges down here. All right, so when that person inverts their foot, they injure a ligament out here on the lateral aspect of their foot. This is called the anterior talofibular ligament. This is anterior meaning in front, and it goes between the talus and the fibula. So big, long, fancy word, but really it's just a descriptive anatomical term. So we're talking about the anterior talofibular ligament. We also have some ligaments here on the medial side. Those are called the deltoid ligament. And those are very uncommon for them to get sprained. Usually we see this happening at the anterior talofibular ligament and the calcaneofibular ligament. And the calcaneus is that heel bone back here, and it's this ligament here. Those are the common injuries. So the first thing we're going to do is we're just going to do, we sprain our ankle, we're going to do general first aid. A lot of this first aid, you've probably heard of RICE, rest, ice, compression, elevation. Some of the new research in the most recent article, most recent edition of Principles of Athletic Training by Prentice, they use prices. So protect, rest, ice, compression, elevation, and support. So protect. First thing we're going to do is we're going to splint this up. All right, we're going to remove them from the aggravating activity, and we're going to splint this up. Rest. All right, they're going to stop their activity. We're going to give this a rest. We're going to let this heal and go through the acute inflammation process and start the healing along that route. Then we're going to ice. All right, ice is a great pain modulator. All right, it's going to help control our pain, and anecdotally, they talk about controlling swelling as well. I think our next two items, compression and elevation, we're going to put an ACE wrap on that. We start at the toes, spiral wrap that from distal to proximal. That means from the toes, moving up the leg, trying to push that back into circulation. Really use the elastic properties of that elastic bandage. And push that fluid back up, and then we're going to get that leg straight up in the air. All right, 90-degree angle, get that foot up as high as you can. If you're sleeping at night, prop it up on a couple pillows so it's above your heart, and we're going to let gravity kind of push down some of that swelling that caused by that acute inflammation phase. We don't want to heat this right away. All right, that initial inflammatory response phase is about 24 to 72 hours, somewhere in there, and then we're going to start going through the different phases of the healing process. All right, and then support. All right, so when we're ready to support this again, this may be like a prophylactic ankle taping. What we would do, if you came into me in the clinical setting, you're one of my athletes, I'd probably do an inversion closed basket weave ankle taping. I'm going to apply some athletic tape to that injury and really help support that. We can also do this different bracing techniques, but it's really going to depend what that athlete needs and their specific limitations and then how much support they need. All right, so that would be our general first aid for this. And then after we get through our general first aid, we're going to start the rehabilitation process. And this is where, what should I be doing? What exercise should I be doing? Should I just go try running? And we're going to take a strategic approach to this. I'm going to talk about some of our goals. All right, and some of the goals that we're looking for with this is, first thing, we want to decrease pain, decrease swelling, increase range of motion, increase strength, and then increase proprioception. All right, so let's talk about these. Decreasing pain is pretty self-explanatory. We don't want this person to be in pain. We want to, if we're doing this in a rehab setting, we may use some of our fancy tools, electric stimulator, things like that, through the gait control model to help control their pain and modulate their pain. We're going to use ice for this in the general sense, so it's going to be a general first aid. We want to reduce their pain. So we keep them stabilized, we rest, remove the aggravating activity, and get some ice on it. All right, decrease the swelling. All right, so what we're going to do with this, we just talked about it. We're going to get compression on this, and we're going to get this elevated. We're also going to use range of motion exercises to help decrease the swelling. So muscle pumping has a great effect to push out swelling. You'll notice, and we want to stay out of a gravity dependent position. So this would be if you're at work all day sitting around, make sure you get up and you try to move a little bit, or at least get your foot, pretend your big toe is a pencil, and write out your ABCs, both big letters, capital A, little a, B, and really draw that out with your foot. Keep range of motion going. Increase strength. All right, and this is probably where you're going to pick up our training plan, and this is probably going to be where you're at. You're looking to start doing stuff again. We're going to do things like towel scrunches. All right, we're going to do 4-way ankle using a TheraBand to try to increase this, the range of motion and the strength in this injury. We're going to also do some stretching. Some stretching is going to happen during this, and then we're going to do things that are going to increase our proprioception. And proprioception is knowing where our body is in space and being able to respond to that. We'll talk about there's like a feed forward and feedback mechanism that happens in the recovery process, and we want to be able to facilitate our body to respond to every little spot that it normally could fall into, and then we would start the return to play process. All right. So this is a general overview, quick way, things that are going to be included in the ankle rehabilitation plan, and this would be for an ankle sprain. You'll find this at thetrainingplansource.com.